bom dia. Sorry, my Portuguese is not that good, and I have to make the presentation in English. Well, I hope everyone understands me well. When we speak about security, when we speak about security breaches, when we speak about cybersecurity, at the end we are speaking about safety of the patients in the healthcare sector. Because of course, at the end, if there's a security breach, the one that suffers is the patient. So I will introduce about how biometrics can help the patients stay safer. The problems lie on the wrong identifications in the healthcare processes, and also that unsecure identification allows fraud by patient identity theft. Those are the main problems we face when we want to make a good patient identification. Let me tell you about Peter Smith. This is a real case, by the way. I think I will only tell you real cases. Peter Smith was in the hospital for an operation of anal fistula. And he was taken to the operating room, sedated. The surgeon came and operated him. Some hours later, Peter woke up in his room without his appendix. And yes, I'm not wrong. He still had his fistula. The problem was that he could not ever have expected another person to be with the same name, the same day, in the same ward of the hospital that suffered from acute appendicitis. Okay? It happened. The fact is that our poor Peter lost his appendix and had, of course, to get an operation of anal fistula. The healthcare staff that made the operation suffered. By the way, the surgeon is a friend of mine, and he had real bad time after that. A real second victim, because he was sued, so it was a nightmare for him. Okay, he all the time said it was not my problem. First, the patient was brought there by another professional. When I came, the patient was already sedated, and I had the name and the medical record of that person. It was not my fault, but the fact is that he operated him and got real problems. Of course, this produced also a loss of image in the hospital and its professionals. And of course, all this made the hospital have greater economic expense, because at the end, first operation of the appendix was operated, and later the anal fistula. So more money, they were losing money, and then being sued and all that. Unfortunately, this is not an anecdote that never happens again, or that didn't happen anymore. At that extent, that the World Health Organization determined 9 areas to improve in order to avoid that the healthcare processes that are designed to heal us produce any harm on our health. From those 9 areas to improve, the right identification is the second most important. The fact is that although the healthcare processes are designed to heal us, as they are implemented by humans, we human beings make errors. And so, at the end, there might be an adverse effect that harms the patient's health. And I come to the hospital with one disease or illness and go out with 2. Well, let me share with you some data from the World Health Organization. Again, this is not our data, this is the World Health Organization's data. By the way, they have a very interesting patient safety commission. They are really concerned about patient safety. And they are making all the time studies on that, not just on identification, but also on right identification, patient identification, but also on the other 8 areas or 8 reasons, 8 areas to improve where patient harm is produced with errors. So look, this is really interesting. Patient harm is the 14th leading cause of the global disease burden. More than 40 million people annually have adverse effects in the world. So people that trust our professionals in the healthcare sector and are harmed by those professionals, unintentionally harmed, of course, by these professionals. And this is something similar, this number, these problems that we are facing with patient harm from the healthcare processes as tuberculosis or malaria. Unbelievable, right? Good. While in a hospital, 1 in 10% of the patients are harmed. And 2/3 occur in low and middle income countries. But anyway, in the high income countries, where all the hospitals have good IT resources, software and everything, they do also happen. 15% of the whole healthcare spending is wasted dealing with adverse effects. It's a lot. So the World Health Organization knows that investment in reducing patient safety incidents can lead to significant financial savings because of that. Those data are from Spain. We get around from 9 to 12% of patients treated in hospitals suffer any adverse effect. And from 1 to 2 in the primary care centers. The expenses in the Spanish studies show that 6.7% of the total healthcare expenses are lost, high income country, okay, are lost due to adverse effects. And most of them could have been avoided. From all these adverse effects produced by errors in the healthcare processes, around 13.5% are produced in hospitals due to wrong identifications. And 11.5% from all these adverse effects are produced in primary care due to these adverse effects. Real data in one of the high income countries. I still don't have the data from Brazil. Anyway, we're working on it, and anytime you can send me an email, I can provide them to you. I think in a couple of weeks we'll have them prepared. But I have the data from Colombia, just to compare. In Colombia, it's also 13.1% of the patients treated in hospitals suffer an adverse effect. And the costs are increasing in 10 times. The costs in case of an adverse effect are 10 times higher. That means that treating a patient that has suffered an adverse effect costs 10 times more than treating a patient that has not suffered an adverse effect. And of course, again, most of them could have been avoided. This is something we find very often with identification errors, that in most hospitals don't have data about their errors, the errors they make in patient identification. They don't have those data. So the managers may think, they say that, it's their feeling, or they want to feel that, they want to think that, since we don't have data about how many identification errors we do and how many adverse effects come from those identification errors, the problem shouldn't be that big. My staff is very careful. They always ask the right questions. So I don't have any problem. But the fact is that simultaneously, the patients are suffering these errors and adverse effects in the same hospital. And the fact is that all the professionals, all the clinicians I've spoken to, more than 1,000 maybe, all of them know from at least from one case where an identification error produced an adverse effect on a patient. And in almost all the cases, none of those identification errors was reported and written anywhere. So how is it possible to have that data? It is not available. That the data, that the cases, the identification error cases are not reported, does not mean that they aren't there. They are not reported, so they are not anywhere. So the question is, for those managers, hospital managers, isn't it a lack of responsibility not to apply a solution where you know you have a problem? You don't know the size of the problem, but you know there is a problem. Okay, you may think, what about the ID wristbands? We have a modern hospital, modern EPR, electronic patient record, and a hospital information system, and we have ID wristbands. So we don't have those problems. Yes, you do. ID wristbands are very good in improving the patient safety, reducing 50% the identification errors, but there are still errors, and errors reported, as you see here, for instance, by the National Health Service in United Kingdom, also a high-income country. Okay, so why are there problems with when you issue ID wristbands? When you come to the admission as a patient, you say your name, or you give your identification card, either the insurance card or your national ID card, was your passport, whatever. And there are people in the admission, in front of a computer, that type your name, type your number. Sometimes there are people with the same name, patients with the same name. In such big databases of patients, of course, there are many people with the same name. So the person that has looked in the database and finds your name may be from a different person. And when they type the wristband and put it in your arm, you will have the identification of a different person. And whenever you go to receive a medical procedure and this wristband is read, the medical record that appears in the physician screen will be wrong, will not be you. And maybe you are allergic, and the physician does not see that you are allergic because the physician is looking at a different person's medical record. Also in the admission, the person may type, the worker, the employee may type a different number by mistake and appear another person. And again, you will have a wrong ID wristband. And you are through the hospital with the wrong ID wristband. Normally, the ID wristband are only placed on the arms of the patients that are going to stay at the hospital, inpatient. Most of the outpatient cases do not wear any ID wristband. So this is worse. Whenever you go let's say, to a chemotherapy, during one day, you stay some hours there, you don't get, in most hospitals, you don't get the ID wristband. So, as I said, also the ID wristbands can get broken, can be dirty, and you cannot read them well. So you will be misidentified in different places of the hospital. It is not enough. ID wristbands are not enough. Let me show you some examples about different processes, because of course, where you have medical procedures that are more invasive, you have the highest likelihood of harming a patient. I may misidentify a patient, but if I give an aspirin, I may not get any adverse effect. But if I misidentify a patient in chemotherapy and give a different chemotherapy to that patient, I may even kill that patient. Okay? So let's see what happens in different processes. Those data are from the United States and the European Union. In radiotherapy processes, which is of course high risk, 1.2% of patients died due to radiation overdose. And 7.3% of these adverse effects are due to patient identification errors. In blood transfusion, 0.1% of all transfusions may have an error. And 67% of all those that had an error were because of identification. An adverse effect were because of identification errors. In case of the admissions, in Spain around 12% of all admissions have an adverse effect. And 13.5% of these adverse effects are due to patient identification errors. So you see, the problem is there. The problem is there, and we have to face it. And that's why the World Health Organization is already 15 years working very, very tough with trying to avoid adverse effects in the healthcare processes. Well, there are more consequences. I have been speaking about the problem in the unwanted identification errors, the problem for the patient's health, the patient's safety. But there are more consequences of wrong identification. Although the most important, of course, if we think of that, is the human being's health. There is also fraud by identity theft. If there is not a good patient identification, it may lead to, it may make easier to the fraudsters to steal an identity. This is something that is especially bad for the insurance companies, the health insurance companies, because I can have a health insurance company, a health insurance contract, a private health insurance contract, and give my identity to my cousin or to my friend. They arrive there and will get operated for whatever, and the insurance company will pay the bill. Of course, all that leads to an economic losses. The unsafety of patients leads to more operations, more medication, of course, makes the hospital to lose money, and the fraud by identity theft makes the healthcare payer to lose money, either the insurance, the private insurance, health insurance company, or the public administration. Then we have the second victims, my friend, as I told you, the professionals that work in the hospital and that suffer when they're involved in an error that harm the patient's health. And then we have the vulnerability of the sensitive patient data. Imagine whenever you're in a hospital, especially for instance in the emergency area, you may even see some computers that stay beside you, and they are very, very close where the patients come, and you will see how physicians go from one part to another. They stay on the computer, they look for something, or they just look for a medical record, or they write something in the medical record, or whatever. But in emergency, they are moving very, very quickly. So the physician goes, another comes. Most of them make login and password. Put login, write down, and type login and password. Most of them don't type login and password, but use the others, login and the others open session. And of course, anyone can come and use an open session in the computer to look for a certain medical record. Let's see if that person has AIDS. Let's see, why not? Okay. Of course, in that case, there are vulnerabilities. When you come to a station or of a certain physician, you don't have the rights to see a certain information of the patients, but you're accessing it. Let's speak about duplicate medical records. This is also a problem. Whenever you come to an admission as a patient and the employee looks for your medical record, if the employee mistypes and doesn't search your number and doesn't find a medical record, sometimes, you know, with the speed they are dealing with people, with patients, they may think you still don't have a medical record in the hospital. So they open a new one. And from that moment on, you will be having 2 medical records. In one of them, the physicians will be able to see that you're allergic, and the other one not. So you better be lucky, and the physician opens the one where it's written that you have you're allergic to a certain medication the physician wants to administer you. Okay? So we have medical records. This is a nightmare for the IT people in the hospitals. They have to filter again and again and to merge and look for the duplicated medical records and to take them out. And between 5 and 10% of all medical records are duplicated in modern hospitals. In modern hospitals, imagine. And 92% of these cases occur in the admissions because, as I said, of human errors, administrative inefficiency. In the United States, this costs $2.5 million in a year to solve duplicated records in a hospital. Of course, in Brazil it will take less money, in Spain as well, because as we know, in the United States everything is very expensive in the healthcare sector. But anyway, all hospitals have their IT people looking and trying to merge different records. We also have, as I said before, the fraud by medical identity theft. In regards of the money it costs, we have the numbers of the United States. They report almost everything. They have all the numbers, you know. We don't do that in the European Union. You don't do that in Latin America, but we don't do that in the European Union either. I mean, they are, in that case, they are a real example of how to do things, to report all the cases, or most of the cases. So there are around 2.3 million patients affected every year by duplicated record, which is a lot. And it costs yearly between $90,000 and $200,000 million in a year because of this medical identity fraud. Of course, it is suffered by the payers, by the health insurance companies. We have also to think that medical fraud also puts in danger the patient harm, because if someone takes my identity, or I have given that person my identity with my insurance ID, health insurance ID, to get the service in the healthcare provider, in my medical record I will have information of at least 2 persons. At least 2 persons, because I may give my ID to more people. And this is dangerous. This is real dangerous, because the medical record doesn't show exactly what the problems I have. For instance, this is a real case that I got to know. I got to work with that company, from a Latin American company, health insurance company, that following their studies, they have a 4% fraud by patient identity theft. That means they are receiving a certain amount of bills, and they were losing $1.3 million every month, paying bills for medical procedures from the healthcare providers that were provided to people that didn't have a healthcare insurance from them. It's a lot. Real case from a Latin American health insurance company. Well, as I said, we also have the problem with the second victims. Between 50 and 70% of all errors can be avoided, and there are around 15% of healthcare professionals involved in adverse effect in a year. That's why we think the solution lies on biometrics, using biometrics in healthcare. Let's speak about a short introduction about what is biometrics. We can identify ourselves by what we have. An ID card, an ID wristband, this is something we have. It is assumed that the person that owns this token, okay, this ID card, this ID wristband, has the identity written on it, okay? But of course, it can be stolen, it can be forgotten, it can be copied. Then we can identify ourselves by what we know, our passwords. But of course, they can be hacked, they can be forgotten. And then we can identify ourselves by what we are, with biometrics, with our body, with something we have in our body. So that we don't have nothing to lose, we don't have anything to get stolen either, okay? So this is the reason why, not just in healthcare, but in other areas, biometrics have evolved that quickly since 20, 25 years ago in terms of improvement of the technology, is because it is not enough secure, nor enough convenient or easy to use, the use of what we have and/or what we know, passwords, cards, okay? So what kind of biometrics do we have? We have different types of biometrics. We can identify ourselves by our fingerprints. You all know about that, okay? So we can identify ourselves with our iris, which is the most secure way of identification. Well, the most secure is DNA, but of course, this is not that automatic. You are not going to make a DNA analysis to anyone that is in front of you. And of course, it has other problems. You get other information that you shouldn't get from a person with a DNA. But from the other methods, iris is the most secure, and you can get anyone identified very quickly, as quickly as with a fingerprint. Then we have the veins of our fingers, of our palms. And this is also very secure, very secure. Then we have the face, and then we have the voice, face recognition and voice recognition. The most secure to identify a person in a biometric database of tens, hundreds of millions of people is iris. There's not only one case reported in the world of two persons having the same image of the iris, in the two iris in the same position. Not one, okay, reported yet. Then we would speak about veins, also very, very secure. And then we would speak about fingerprints. One of the good things of iris is also that you can use the sensors without touching them. You just look at the camera, okay, like with face recognition. With fingerprints, you touch the sensor. Fingerprint biometrics are also very secure, okay? If I have to identify a person, well, let me tell you about identification one-to-one and verification one-to-one. Identification one-to-one means one-to-many, means I get a biometric, I get a certain biometric pattern, for instance, a fingerprint, and I compare it, I match it with a whole database. Maybe I have 10 million people in my database, or 1 million people in my database, okay? And I compare it with that. And the answer is, this fingerprint belongs to Emilio, okay? This is one-to-one identification. Whereas one-to-one verification requires to know the name. For instance, in the admission, I go to the admission and the employee there asks me, what is your name? Emilio Gallego. The employee sees in the screen my medical record, my record, and says, please, could you place your fingerprint in the sensor? I do it. And at the end, the answer to the biometrics, the question to the biometric system will be, does this fingerprint belong to Emilio? And the biometric system will compare this fingerprint taken live just with the fingerprint templates stored in the database for Emilio, okay? So it is much easier to do a one-to-one verification and much convenient to do a one-to-one verification in terms of the time of the employee, okay? So If I had to perform a one-to-one verification in a huge database, I would, of course, use iris. For, let's say, 90, 100,000 people in a database, I can use fingerprint with one finger. If I need more than that, imagine we have 1 million people in the database, and I want to use fingerprints. So I would use 2 fingerprints. So that I'm sure that the likelihood of having an error is very low. The good thing about face recognition is that we don't need specific sensor. We don't need to put specific sensor because any computer, any smartphone, any tablet has a camera. And we can use it. This is the sensor, a normal camera. As with a voice, any microphone takes this information. So what we do is we'll make, with biometrics, we will have an unequivocal identification of patients. You can see here, for instance, here down, there's with fingerprint, the person in the admission, coming in the admission, and there, this is also a real case in one of our customers, and in the hospital information system shows immediately in 1 to N, shows the medical record of the person. Here you can see biometrics biometric technologies have one negative thing. This is only one, but it has. In order to be able to identify with security any person, you need to enroll, to register the biometric data of this person once, okay? So here you can see that there is an iris sensor, there is a camera, there is a fingerprint sensor, and they are enrolling, they are registering the biometric data of this patient, so that afterwards this patient can be identified in any place of this healthcare network. There are more than one hospital, okay? And here you can see this in a chemotherapy area, the person is identified by the iris with the tablets they have in this area. You know, they are using a small mobile iris sensor before giving administering the medication, which is high risk, as you know. At the end, with biometrics, we can reduce healthcare spending, eliminate 100% of the fraud by identity theft, and eliminate 100% of the adverse effects. We can also, in terms of patient identification, we have already spoken about all that, but in terms also of staff identification, we can be sure that no one but the right physicians are able to see the information of a certain patient in the electronic patient record database. Of course, we can use also the biometrics to enter certain areas with drugs or certain drugs, so that no one else can come in. We get traceability of everything what the staff does. Anyway, the highest value of biometrics are related to patients, to patient safety, and to avoid this loss of money in the companies, in the healthcare companies. Well, so same case with biometrics in the admissions. What would we see? The same patient, Emilio, comes to the admission, and we can, and the employee says, please, can you place your 2 fingers in this fingerprint sensor? I will put them there, and immediately in the hospital information system in the screen shows my medical record. It doesn't matter if I show a card, if I say my name, it doesn't matter. The employee is sure, without having typed any word, any letter in the computer, is sure that the person in front of him or her is Emilio. And if there are ID wristbands, that person, the employee can print it, being very secure that that's the person I have in front of me, the medical record. And of course, in that same moment, in the admissions, we have avoided duplicated medical records. From that moment on, there won't be any duplicated medical record anymore. And we have avoided any fraud by identity theft. It is impossible that anyone comes with his or her cousin's ID card, that's insurance card. It doesn't matter, because you will prove who you are. You'll have to prove who you are. Let's think about radiotherapy. Imagine, there's something also, a process we have implemented. A certain patient comes to radiotherapy, and first of all, looks at an iris sensor in the wall, and to make check-in. After this check-in, stays in the waiting room. In the hospital information system, lights that person is already in the waiting room. At a certain point, the employee says, look, come to the bunker, to the linear accelerators, your turn for radiotherapy. In the entrance door, there is also an iris scanner. And again, the person looks at it. And the software of the linear accelerator shows that's the person that should be, and this is the doses that have to be administered. So the technician there says, okay, come into the bunker. And everything is registered, reported, okay? So if we have person with glaucoma or other problems in both eyes, we will use also in that case fingerprints, so you have both. Well, and that was it. I have still 4 minutes, and I would like just to say that if you want the presentation either in English, Spanish, or Portuguese, we are doing it in Portuguese as well. Just send me an email, and I will be very glad to send it to you. I will try in these 4 minutes I still have. You can imagine how many anecdotes I know about problems in different hospitals. You can imagine. I will tell you one that was a surprise for me. And certain hospitals in an area in Europe, very close in a high-income country, with very good public hospitals, in the border of another country that is a low-income country with not a good hospital system. Most of European countries, European Union's country, have public hospitals with good and very good quality service, and where anyone pays, because it's paid by the government. So they have in those hospitals, in those two hospitals, they have an average of 1.5 TACs, tax, per inhabitant. So imagine, and they have, sometimes there comes a woman to have a baby, and they see that this woman has had the baby already 1.5 months before. So they have many anecdotes like this, because anyone comes and says the name, and then, or shows a certain ID card, and then many other people, friends, cousins, whatever, that don't have the right to get the service because they don't live there, but come just for that, get the identification of their cousins and friends that do live there, just to get this service. So the medical records, there are many medical records that you cannot trust. And they have a big problem with that, that we are about to solve. So thank you very much for your time.
Obrigada, muito obrigada, senhor Emílio Gallego.